Hi, I'm Representative Alana Rubel, the House Minority Leader here in the Idaho Legislature, bringing you an update on what happened in your capital this week. We started off first thing Monday morning with introducing our medical cannabis bill to legalize medical cannabis for those who have severe illnesses and who would be prescribed by their doctors. We had very compelling testimony from one of Idaho's leading oncologists, Dr. Dan Zuckerman. We also had very compelling testimony from Sergeant Jeremy Kitzhaber, a 22-year Air Force veteran suffering from terminal cancer. So we'll see where that bill goes, but we're very excited. It got successfully introduced on an 11-1 vote. So now we need to move forward with hearings and hope that you'll email in and support House Bill 108. Other things that happened on the House floor, the House passed House Bill 90, which was what we felt was a real overreach into local control. This bill would have required cities and counties and towns, local governments, to get the legislature's permission before they can rename any schools or parks or monuments or anything in their own communities. We feel that that really belongs in the domain of these local governments, and that it is a big overreach for the state legislature to say that, we need to be consulted before anybody anywhere in the state can name something in their own community. I did obtain an attorney general opinion that said pretty clearly that this bill has a lot of legal problems and is unconstitutional. So while it did pass out of the House, I'm hoping with that opinion it will hopefully not move further in the Senate, but we shall see. Again, that's House Bill 90. Another bill that ran into some trouble on the floor was House Bill 88 yesterday on the floor. This we felt was really a voter suppression bill. It was a bill that would have made it a felony to deliver somebody's ballot for them. Even if there's nothing nefarious, if you haven't filled it out for them or stolen it or anything, the person has filled out their own ballot, sealed it, signed it, and said, "Here, can you drop this off for me?" Which is something often that seniors need, people with mobility problems, people who don't have cars, the elderly. It's often poor folks, and they turn to a trusted friend or neighbor to drop off their ballot, especially when you get closer to election day, and it's likely that the mail won't get it there in time. So making it a felony to help your neighbor deliver their ballot really felt pretty outrageous to us, and something that was just really going to have a result of making it a lot harder for vulnerable populations to vote. And actually it looked like it was going to die on the House floor. It was ultimately sent to general orders as opposed to passing. So I'm hoping that bill goes away. But it was really something to hear. This Mike Moyle, the majority leader, was the sponsor on it, and he proclaimed in his closing argument that voting should not be easy, which we really couldn't disagree with more. We think voting should be safe, secure, and non-fraudulent, but there's just no reason for this legislature to be trying to make it as hard as possible for people to vote. We think it should be easy, actually. So we'll see where that goes. We have other big picture plans with the surplus that the state is looking at. We think it's finally time to fund full day kindergarten, which is something that has been recommended for a long time and would help our state fix its rather poor performance in literacy numbers. So keep your eyes peeled next week for proposals along those lines. And first thing Monday morning, I have a hearing on my specialty infant formula bill, which I'm excited about, for kids that have rare digestive disorders and whose lives are endangered, and they need these very expensive specialty formulas to survive that can cost families up to $2,000 a month. So that's a sneak preview of some of what's happening next week. Thanks for tuning in. Please stay engaged. Remember that you can testify virtually at any hearing, and we need your help to get some of these things to happen. So thanks. Enjoy the weekend, and hope to see you soon.
Welcome back to the end of what is now the middle of the legislative session. And I am Senator Michelle Stennett, the Minority Leader in the Senate, letting you know what's happening on the Senate side and some general information. What came before us that'll probably be interesting to you is all of our public health districts came together and unanimously decided on a new way to operate as far as managing emergencies and disasters when it impacts the whole county or the public health district. And that is to run it through the commissioners and not through the board members. As you know, most of the board members are comprised of either commissioners or commissioner appointees, and they felt like in order for the public to hold them accountable and for larger disasters, not all of the huge variety of things that public health districts do ordinarily, but in the case of something that impacts the public generally, that the public officials who are elected should be held accountable and have a say first or run it through them, and that the appointees on the board shouldn't be held to make those larger decisions. So it came out of our Health and Welfare, the Senate Health and Welfare Committee. It is going to the floor. I wanted to bring that to your attention. Also, which came to the Senate State Affairs Committee, which I'm on, was a print of a new restrictive suppressive for ballot initiatives and referendums. We always get these about once every year or two, and it's a way to make sure that you have to go through more hurdles in order for you to be able to have a say and to tell the legislature and the legislative and executive branch that you do or don't like what we are doing through a public process. Aside from voting, that is the one way you let us know what you want us to do. Unfortunately, the bill is going to request that you gather an even number of signatures through all 35 districts. The last time this came to us, our parliamentarians and constitutionalists said that we have the most restrictive initiative referendum process of the states who allow for that, and that this is going to further exacerbate our constitutionality as it pertains to gathering signatures. So we will have a robust debate in state affairs. Again, I just want a heads up. I feel like this is suppressive to the voter process, to your ability to have a voice in the work that we do here. And so pay attention down the road to let your legislators know how you feel and be watching about what happens with this bill. I had mentioned earlier that we are about halfway through our legislative session and we have only passed one law. Unfortunately, it just proves that the legislative branch is not nimble or efficient in how it does its policy making, and there has been a lot of grandstanding and infighting and power grabbing, as we mentioned in earlier podcasts with you. And it is an example of why, when you have an emergency order and you have a sudden disaster or a sudden emergency that you need to get resources to your public in a timely fashion, that the legislative branch just does not operate that way. And if it's taken us 6 weeks or more in order to pass one law, it will not benefit us in an emergency or a disaster to be the first line of branch to go through in order to get things done in a timely fashion for you. So I wanted to just let you know that we are working hard to make sure that we keep in contact with you. So keep looking at our newsletters. Happy Valentine's to you this weekend, and we will see you next week.